Herzlich willkommen und wunderschönen guten Morgen hier aus Berlin. Bernhard Giebes ist mein Name. Ich leite Sie durch den ersten
Welcome and good morning to Berlin. My name is Bernhard Giebes and I'm going to present the first session of today's event. And thank you for taking your time to look into the results of our survey and to learn more about what we can do in order to promote medical education in a European context. We are talking about three organizations here. First of all, the German National Association of Statutory Health Insurance Physicians and the Association of Faculties of Medicine of the German universities, and the third partner, the German Medical Students Association, that cooperate with us in a European context and work on this survey. This is actually the fourth survey, and we're going to have some longitudinal results, and we will also look into France and Switzerland, what they are doing. Are there any particularities about Germany, or do we find a similar situation in Switzerland or France? Are we talking about free practice or hospital doctors? And what about rural areas? And these are questions that a lot of medical students are asking themselves, facing a number of challenges such as digitization and COVID, and the question of an appropriate work-life balance. And this was all subject of a survey that took place and it was carried out during the summer. And Professor Jakob is going to present this survey to us. But first of all, I would like to ask Mr. Wissing from the Association of Faculties of Medicine of the German universities to present his words of welcome. Good morning. I'm happy to join us online because this is a hybrid format and I hope that you can all see and hear me. Thank you very much for having me. I'm delighted to see so many of you here joining us online and on site. The MFT, the Association of Faculties of Medicine of the German universities, supports this survey for the fourth time, and it's very interesting to look into these results. We have been following these developments for more than 10 years, and it was really great to see some of the results. But it's very interesting to see how things have developed during the years, and we can only look into the current situation. But it's interesting to see how things have developed after the pandemics, and to learn about the impact of COVID on the expectations of students. So I'm really interested in finding out more about the outcome of this survey and our debate today. And Mr. Gibbs has already mentioned it. It is very interesting to see the international comparison and to find out whether situations in other countries are similar or different, and why we are going to see these differences. And I'm also looking forward to our panel discussion. We think it is also important to look into the medical courses as such and to learn more about the students becoming a specialist, and they may also change their attitude and expectations. So as a medical school, we will follow the developments of these students, and of course we would like to find out more about the new regulation for licensing regulation for doctors and find out what the expectations are regarding the development of this model course. And I hope there will be an interesting discussion. I would like to thank the faculties and schools and the students, of course, who took part in our survey thinking about these questions. So I would like to thank all the students participating in the survey, and I would also like to thank the German National Association of Statutory Health Insurance Physicians, and I would like to thank Mr. Jakob and the University of Trier to give this presentation showing us the results of this interesting survey, and I hope that there will be a fruitful discussion. Thank you very much, Mr. Wissing. A massive thank you to you. This was a very good cooperation with the MFT. This enabled us to carry out this fourth survey, and this is a great project with very interesting results, and we are looking into this outcome. Professor Jakob, you are Professor for Applied Social Research at the University of Trier, and there is also a part of this presentation, and we're very much interested in the results. Good morning and hello also to all those who are joining us online. Mr. Giebes has already mentioned it. There is a new part of the survey. It was a pilot project. We carried out this survey in France and Switzerland as well, the fourth wave. And we carried out this survey in summer 2022. So this is actually the fourth wave. The first survey took place in 2010 and 2014 and then 2018. And you can have a look at the website of the KBV in order to find out more about this survey. And we started out in 2009 in Rhineland-Pfalz. There is one partner that was missing. There are four partners, and that is, well, us, the University of Trier. And this has been a very good cooperation, and this long-term professional monitoring has become a renowned standard regarding the expectations of medical students. As far as the design of this study is concerned, this is an online survey, took place in June 2022, and the idea is that it's a kind of census using the mailing list of all universities to reach out to all students. Well, this is not always completely possible, but since 2010, this has been a self-selective sample, so it's very hard to find out who received this email and who will respond to it. But we had about 12,000 participants during the past three surveys, and this time it was 8,600 participants. This is about 12% of all medical students in Germany. There are some faculties that have not taken part, like Regensburg and Bielefeld, but otherwise these we can also find out about the results of the individual medical schools, and this is what we did in the past. Whenever universities are interested in finding out about the outcome concerning their own students, this is possible to illustrate. So here is the new part, the online survey in France and Switzerland, and it was thanks to the Medical Students Association that we could reach out to students in France and Switzerland. 328 students in France and 330 students in Switzerland took part. So I think this is a good result. And if you look into the overall number of students, well, it's a rather small sample. And as far as, well, female and male participation, it's also quite similar. So, well, medical students are usually female, so 2/3 of them are female. As far as the results are concerned that I'm going to present to you, I hope I'll manage to stick to the timetable. I will have 35 minutes to present the results to you. First of all, the expectations of medical students as far as free practice and hospital employment is concerned, and we wanted to focus on general medicine, surgery, and orthopedics. And this is something that we need in primary care hospitals, and we would like to know more about the recruiting potential, and we would like to find out about working conditions, where to work and where not to work, and of course some ideas on studying during COVID-19, and a few questions on digitization. This is what we introduced in 2018. First of all, some expectations regarding the medical profession. And what we can see here are the German data. So actually this data is quite consistent. So expectations have not really been changing. First of all, it's work-life balance that matters most. And so students would like to have regular and flexible working hours, because more than 90% of the students would like to become a mother or father. That's why that is important to them. However, treating a broad range of diseases is something that has become less important, and that doctors or future doctors would like to know more about the patient's history and the conditions of the patients has also become less important. Working in a team plays an important role, but it's less important than reconciliation of family and work. And then there is the wish to have a practice of their own. So it's a bit fluctuating. So now the result is 55.1%. Comparing the different countries, we can see some differences here. If we look at France, so I put this in bold font. Otherwise, Germany and Switzerland are very similar, but here we have regular working hours. This seems to be less important in France. It's less than 50%, considering this to be important. And the request for flexible working hours, we'll see that this is less important for France. But on the other hand, in France, medical students are more interested in patients' history and the living conditions of patients. And in France, medical students consider working in a team to be more important than in Germany and Switzerland. On the other hand, there are fewer students in France that would like to work in free practice, but this might be due to the fact that the system in France is different from Germany and Switzerland. And now we can look at the results comparing 4 years, because regarding free practice and hospital employment, this is an essential issue. So no matter we are talking about GPs or specialists, here we have a multiple choice question. So the idea is, well, about 3/4 think that working in a free practice is an option to consider, but rather if you want to become a specialist, what is becoming a GP in free practice is less attractive. So we would have liked this trend to develop further. What seems to be very attractive is hospital employment. So the result is between 92 and 96%. Well, this means either working at the hospital or a practice in inpatient or outpatient care. But as far as the ambulatory sector is concerned, we have also seen an increase from 67 to 77%. Either we're talking about a practice, a free practice here, or a medical service center. And what has also been stable is the number of students that think it would be that can imagine to work at a hospital after their studies, and where the results are very similar in Germany, France, and Switzerland. But when it comes to GP care, well, in France, this seems to be more attractive in France, which might also be due to the system in France, and medical service centers, something that does not exist in France or Switzerland, but working at a practice of a self-employed doctor. This seems to be quite interesting. This seems to be an option.
Now, on the recruitment potential in these two problematic areas of general medicine and surgery. And here again, we have results covering 4 years or 4 waves, and can show you the longitudinal development. Those who started in 2010 were in their practical internships in 2014, and that means here we're covering basically 2 cohorts. And again, there's a question about the preferences for general medicine. One question was, if you had to decide now what type of specialization would be interesting for you, and people could pick 3 options. And the second question was, if you had to decide now, which one would you pick? That was a single choice question. But that question was only added in 2014, so we don't have data from 2010 on that question. Now, looking at the results, we see that the interest in general medicine has increased from roughly 29% to 36%. And that applies mainly to men. And I think that is a result to be welcomed. And looking at the different parts of the training course, we also see that there is a positive development. I said before, if somebody started in 2010 studying, then this person would have been in their practical phase of training in 2014. And we see in the figures for the first cohort an 8 percentage point increase, and then for the second group as well, although that trend is somewhat stagnating in 2022. We were hoping after the good results last time that this trend would continue, but that doesn't seem to be the way. And that's why I marked the 36.7 in yellow. I think we need to further analyze where this result came from. And then surgery, not a very convincing picture. The figures are lower, or basically on the same level, roughly at 25%. And there is no increase here. And unfortunately, even among men, that figure has decreased. Surgery was never a very attractive subject for women, but even among men, it has become less popular. Now, the dramatic message here is, and that was also the case with the last wave, is that surgery becomes less interesting. At the beginning, when people start studying, they are 36 who are interested, but then that figure drops. And then we can be rather sure that these students won't later pick up surgery as a job. And unfortunately, we also, or we can say that surgery was never the most popular topic, and men are still more interested in surgery than women, but even here the interest is receding. And if we are looking at a number of retiring surgeons, then this will become a problem. The next question was about where people want to work or would never work, i.e., are there regions that are particularly attractive or areas where nobody wants to work? This is the German data. The red bar is for 2010, and then come the other waves. And we've asked who would like to work in their home state, in their home region, in another federal state in Germany, or abroad. And there are two trends. Many people want to work close to their home, either in their home state or their home region. And here, basically nothing has changed in the last 12 years. And then there is a second trend. There is generally less mobility and less willingness to work in a different federal state or even in a different country. Now, this might be good for the German labor market. If we see that there are not very many people who want to leave the country, and that could mean that they are a resource for the German labor market. We see here the drop from over 60% to almost half of it. But now let's look at comparison with France and Switzerland. Germany is in red, France blue, Switzerland green. Now, we don't know how selective this data is, because the Swiss and French respondents might generally be interested in an international outlook. And we see that they also very much like to work in their home region, but there is still a higher willingness to work in a different region within one's own country or even abroad. Although, as we will discuss in a minute, abroad is also, to some extent, a limited selection of countries. And what we see here is that people still don't want to work in rural areas. You see here, first of all, towns with up to 5,000 inhabitants, and then the next category of towns with up to 10,000 inhabitants. And there are many such places in Germany. We see here in Germany a number of 44%, or a little bit under 40% of students who say they will never want to work in such a region. But that's only the picture in Germany. It looks a bit better when we go to France or Switzerland. Interestingly, especially for the very small towns. In France and Switzerland, more than 70% could imagine to work in such rural areas. And that figure is much lower in Germany. So apparently this is a German specificity. And we saw before that the French and Swiss respondents who participated in the survey seem to have a more open outlook. Now, and here are a number of destinations where people could imagine to work. Let's look at the German answers. Now, very obviously, there would be countries on the list where people speak German, like Austria and Switzerland. And then looking at non-European countries, we have Canada and the US. In France, we said that people are generally more mobile and more interested in working abroad, but they also mainly list foreign countries where people speak French, like Switzerland and Canada or Quebec. And other than that, other countries don't seem to be very attractive to French students. And then Switzerland, the results were a bit surprising. Apparently, quite many of them could imagine working in Germany. 43%, 42% could imagine going to Great Britain. Austria, not really. Perhaps that's a historical fact going back to having been occupied by the Habsburg rulers in the past. And then a few comments on studying during the COVID pandemic. We had asked whether the pandemic, and especially the mitigation measures taken by governments and policymakers, how these measures affected studying. So basically studying via Zoom, no face-to-face teaching, no internships. So what was the impact of that on the development of important skills you need for your professional practice later on? In all of the three countries, 2/3 say that yes, there were repercussions. So all the restrictions had an impact on medical students and their skill development. But what's interesting here is that the assessment of whether this was positive or negative is very balanced. There's an equal number of people and students who think it was positive or negative. In Germany, there was a larger group that said the implications were rather negative. They missed out on skill development. And here the figure is almost 60% for negative. In Switzerland, a large majority has a very positive assessment of the situation, and it would be interesting to analyze why this is the case. So rather significant differences between these three countries. Then we asked about important skills that were either improved or negatively affected by the pandemic. And here you see the relative figures. Now, first, self-organization. Here people have improved. I mean, that's obvious because everybody had somehow to muddle through, learn about the technical tools, etc. But then looking at communication with patients and practical skills for treating or examining patients, here a relative majority of German students says that these skills have deteriorated. And also communication with doctor colleagues. That's an area that suffered from the pandemic. Interestingly, the picture is different in France and Switzerland. In both countries, there are relative majorities which say that certain skills have actually improved. And only a small number of students thinks that there have been negative developments. So here it should be really interesting to find out how they organized or reorganized their training in these two countries and how this affects this perception. Now the next topic is digitalization, and I think it was included for the first time in this survey. We asked the students what their take is on digitalization. What do they think about the purpose and the objectives of digitalization in their countries? And how do they see the implementation? And here is very clear, the objectives or the purpose might still be acceptable. So what they have here is a satisfactory result. My students believe this is rather good, but I would beg to differ. And then looking at implementation, the mark that was given is only 4.5, which is very poor. We've had a model project for a cross-sectoral introduction of patient records in 2005 and 2006. And I think you all know what I'm talking about. You know that we haven't really made any progress in the meantime. We're almost celebrating our 20th anniversary of this project. And unfortunately, we haven't really made any progress. Going to France and Switzerland, the assessment of the general purpose of digitalization is similar, but looking at the implementation, the students' assessment is somewhat better. 3.5 is still not a great mark, but at least it's better than in Germany. And that result is similar in Switzerland. So again, the mark given for implementation is only a 3.7. That means in all of these three countries, the assessment of the general purpose of digitalization is similar, but the assessment of the implementation is poor, with Germany having the worst result.
And as far as digitization is concerned, we wanted to know more about the students' expectations and what they think would be the impact on practical care services like diagnostics or treatment. So is this considered to be an opportunity or a risk? And here this is quite clear. And we can see that German students think that there is, well, a great potential provided by digitization, and, well, the only negative impact would be on the relationship between doctors and patients. But in all other areas, an improvement is expected, and of course, the way it is implemented can be improved, but there are expectations, and students think that there is a huge potential to tap on if the right approach is taken. And the situation in France is very similar. Students have a similar take on that. Again, it is only the relationship between doctor and patient that might suffer from digitization, and the situation in Switzerland is similar. So in all three countries, there are a lot of expectations, but as I said, the relation between doctors and patients might suffer from digitization. This is what students think. So this is it, and I think now we are having a Q&A session, if I got this right.
Vielen Dank für den hervorragenden Vortrag.
Thank you very much for this great presentation, comparing the different surveys and the three countries. I think this is a lot of food for thought for our discussion, and all those who are joining us online, you can either use the chat or our email address, newwork@kbv.de, newwork, one word, or you use the chat to ask questions. Our facilitator will collect questions and then ask these questions here. And now we will hear more about now we hear Mrs. Wawra. She is the representative of German Medical Students Association, and she will tell us more about the take of medical students. And she will tell us what we can do today in order to improve future working conditions so that future colleagues are happy to work as a doctor in Germany. Good morning, everybody. First of all, a massive thank you to the KBV, the MFT, and the University of Trier for this very good cooperation. We are delighted that this survey has now become a European one. Given the increase in mobility and the global crises, healthcare is something where we need to look outside the box and have an international take. Of course, there's an upwards trend on general medicine, and this shows that, well, attractive courses can help to motivate students to put a focus on general medicine. But surgery and orthopedics are getting less and less attractive during the course of the study programs. And it is also important to improve the work-life balance when working as a surgeon. For about 4% of the students taking part in the survey, it is a possibility to work as a specialist. And of course, we hope that this is a good approach in order to make this more attractive. Then there's another important item, and that is COVID-19 that has already been touched upon. And of course, this has had a huge impact on the studies because almost 2/3 of the students were involved in fighting the pandemic at different places. And for the majority of students, the pandemic had an impact on skills, especially when it comes to communicating with colleagues, patients, and also on their practical skills. During the peak of the pandemic, a number of practical modules were just cancelled, and that's why we need more support for future doctors in order to deal with these deficits and deleted courses. The survey illustrates very well that a number of wishes and expectations of students will require long-term changes in order to establish a viable healthcare system, especially the amendment to the licensing regulation for doctors. So it will be very interesting to see how these changes in priorities and in study courses might have an impact on the expectations of students. Thank you very much for your take on this survey. And now we have the opportunity to hear questions to Professor Jakob or Mrs. Vavra. Of course, we will afterwards continue with an input by the European Commission and a panel discussion with renowned panelists. And if there are any questions, we are happy to answer them. Any questions? There's an interesting question. What about the results of the A-levels of the students interested in working as a GP? Well, there are a number of reasons why we didn't do that. There was also a comment on that. Maybe we should consider whether the numerous classes might be an obstacle, and doing away with this might help to find more GPs, because those students who might not fulfill with these numerous clauses requirements might be interested to become a GP. Well, this is a subject of a debate in many countries. Well, we don't know whether the numerous clauses the only thing that is essential for a future career as a doctor. And when looking into the male-female proportion, well, the numerous clauses is one reason why we have so many women studying medicine. Well, and maybe we also need quotas for male students in the future, but we will find out about that. And I hope that we can also look into other European countries. Thank you very much for this question. I would like to encourage you to ask more questions, and we will try to answer all of them. And then there is a second item on our agenda. This is not a topic for Switzerland, France, or Germany alone, because we have a lot of interdependence here. So we have to find out whether we're taking the right approach at a European level once many of us will retire, and how do future doctors would like to work. And the European Commission has to do something about that as well. I'm very happy that Mrs. Pufkins is here today to present the situation at a European level. And Mr. Wismer from the European Observatory on Health Systems and Policies will be our facilitator for this part. So the floor is yours, Matthias. Thank you, Bernhard. Thank you very much for this great event. It was very interesting to learn about the comparison between the different countries. This is not a German problem. It's a European challenge because, as I said, there's a lot of interdependence, and we can find out about best practice. We can find out about what it's not working in other countries. The COVID pandemic has led to a number of ideas that are quite innovative. And now I'm Mrs.
Thank you very much, Dr. Gibbis, for your introduction. And I would like, first of all, to thank you very much for inviting me to this very interesting seminar, and congratulate you on the results of the survey itself and on carrying it out, because I think it shows the importance of gathering knowledge on these very important issues concerning attractiveness of medical professions. I would like to share with you the European perspective. And first of all, I would like to shed some light on one of our recent products, which is the State of Health in the EU Companion Report. We published it almost 1 year ago, so it's not so recent actually, but the messages still resonate in the current context. So this publication basically shows three important messages. One of them is that we need to understand better the impact of the pandemic on the health systems. We saw very well that the impact has not been even among the countries. We saw that the pandemic disrupted access to services, health services, in a different way in the European countries, and we don't have sufficient metrics right now to assess what happened and to be clear about the impact on health systems. Another important message, which also resonated very well in the seminar today, was the impact which was triggered by the important acceleration of the uptake in the digital technologies. So we also need to assess the efficacy, cost effectiveness, and the overall impact of these tools to be clear that we can sustain these solutions in the long way and that we can sustain them in the right way. Because, we don't hide that a number of challenges were associated with this extremely rapid implementation of digital technologies in the context of the pandemic. So we certainly need to make sure that we avoid unintended consequences in the implementation outside the context of the pandemic, and that the technologies are adjusted to serve a broader set of objectives. The pandemic also shed more light on the importance of rethinking health workforce strategies and health workforce planning. This is not, of course, a new challenge. We knew very well that many member states struggle with shortages of health professionals, and the pandemic clearly led many of them to suffer from the immense pressure, and some of them from mental health difficulties. And as I said, problems have been fundamentally rooted in the health systems due to inadequate support, escalating workloads, underinvestments in healthcare. This certainly pushed health professionals to the brink. And we are not facing only the shortages of healthcare professionals, but we unfortunately see a decline in the number of medical professionals because they simply decide to interrupt their activity or even leave the profession. The countries during pandemic implemented many strategies to sustain the health workforce, but we need to make sure that we have a longer term approach to it and that we also integrate the cases of sudden shocks in health systems in the ways we organize and think about the strategy behind the healthcare workforce. And I wanted to show you a few slides very briefly talking about the challenges which we see at the European level. You can see here a slide showing shortages. So shortages are an important issue in more than half of member states. This slides presents a very simplistic analysis because it shows the position of member states according to the EU averages for doctors and nurses per 1,000 population. And I don't claim to say that these benchmarks are the right ones, because we saw in some member states which were about the average that they also struggled during pandemic. So it's important to say that this is a bit simplistic. And at the same time, the slide shows the huge variation in the size and the composition of health workforce across Europe. So in some of them, we see the critical shortage of nurses rather than doctors. And there are also countries which present the opposite pictures. Another challenge which was already mentioned are the regional disparities in the distribution of healthcare professionals. This has been highlighted in almost half of member states in our publication. And the trends are quite similar everywhere. So they tend to follow a pattern where urban welfare areas have a higher density of healthcare professionals than those who are remote, less affluent, or have the rural characteristics. And I would like to highlight here that the increase of healthcare professionals is not the only solution. It's not a solution in itself. We need measures which improve the match between the supply and the demand for the benefit of the underserved areas. And what we need to certainly think more about are more complex approaches to boost the number of professionals in the underserved areas. There is a need to have a comprehensive view at regulation, incentives, or telemedicine, and their implication for more even distribution of staff. We have seen very well that financial incentive itself is not a decisive factor. Proximity to family, social life, education, job opportunities for family members, Practice conditions, work-life balance, living conditions determine even much more a physician's choice of the location. That's why in this publication we call for some kind of rethinking health workforce strategies, because building the resilience of health workforce will require actions at multiple levels. We need, first of all, more sophisticated tools and ways for workforce planning. We also need to increase the investments in skills and mix innovations along the sustained expansion, of course, of health workforce. And some countries we see clearly that some countries need to reevaluate their forecasts for future staff needs and increase the investments in health workforce. Besides increasing quotas of medical and nursing professionals, this will require also increasing support for clinical placements and setting up incentives to reduce drop-out rates and support students throughout their healthcare studies. I also would like to show you very briefly what we collect in terms of data on working conditions. So we have the Eurofund agency who is doing regularly the surveys on working conditions in various sectors. And as you see on the slide, this survey shows that work affects negatively almost 1/3 of health professionals, compared to 25% of workers overall. 28% of health workers work in shift regime, compared to 15% overall. And 31%, compared to 2% overall, experience specific physical risks in relation to work due to contact with materials that can be infectious. So clearly, the working conditions for health professionals seem to be much more yet demanding than for the overall population. We also looked at the data from the EU Structure of Earnings survey to understand a little bit the attractiveness in terms of pay for healthcare professionals. And this survey shows that only in France, Greece, and Hungary, the average hourly earnings of health workers are well below the average of earned by all the workers. So the disadvantage it's not so big here. What do we do currently at the European level to address these challenges? So we work both on methodologies to improve health workforce planning, and we also try to develop some actions on skills. We have a current ongoing work under the third health program, which supports a cluster of projects addressing problems of medical desert. So these areas which are less served in terms of healthcare professionals, task shifting, and workforce retention. Those projects started a year ago, and they have 2 years more to go. This is an open initiative. We organize thematic seminars with project leaders. So if any of these topics is interested to you, I will be very glad to send you the link to our health platform, through which you can connect and follow up the developments. And I think that one of these initiatives is certainly very interesting for the topic of the seminar today, the project which is called Meteor on retention of workforce. So it looks at how to better understand the determinants of retention and it will achieve it in two ways. First, there is an ongoing survey with healthcare professionals looking at determinants of burnout, mental health, job satisfaction, and turnover intentions in 8 participating hospitals from 4 member states. And the second step will be co-creation workshops, which will provide certain recommendations, policy recommendations on how retention policies could be improved. So I recommend very much to follow up the developments under these projects. We are always very happy to see interested parties taking very active discussion in the seminars which are organized. It's very enriching for the results of these initiatives. Another important project which will kick off in November, in 1 month exactly, is the Joint Action Heroes. This is the joint action led by Italy, and we have 18 participating member states. And what this joint action will help with, it will help to develop better tools for workforce planning, and it will also build capacities of member states to use these tools in an effective way for the policy feedback, for the design of workforce policies. And I think that, yes, all these changes caused by the pandemic, also the expectations which we heard about today from future health professionals, I think that this all matters very much for workforce planning. That's why I would like, because in the past the Commission supported already work on workforce planning, but I think that the context is different and we need more sophisticated tools to understand better what are the factors which affect the supply and the demand, to capture also these dynamics related to the attractiveness of work of healthcare professionals. So it is a very, I hope it will be a very useful initiative for member states, and we will certainly publicize the results at the EU level, try to see how we could also improve the data collection, which helps actually to arrive at better estimates of workforce we need in the future. We have 2 initiatives on skills. One is already ongoing. We kicked it off in July this year. This is the so-called Pact for Skills partnership. The idea of this partnership is to create a shared engagement for skills development in Europe. This partnership was kicked off under the portfolio of DG Employment, who works on improving skills in Europe overall. And we create these various skills partnerships in many sectors. Health is one of them. This is, I believe, also an interesting initiative which will produce a skills strategy for us with the focus on the needs related to future-proof health systems. So there will be a specific focus on digital green skills, skills we need to manage better demographic change, and so on. And you are also welcome to join this partnership. Because the idea of the project is not to limit it only to those who are members of the consortium working on the concrete deliverables, but the idea is to have a participatory manner in arriving at these deliverables. So we would like to hear from healthcare professionals across Europe what they think about the strategy which will be presented, what they think about the experimental curricula which will be developed under this project. So I will also be very glad to share the contact details and explain how you could join this initiative if you are interested. Another skills initiative is a call for proposal which we launched under the EU for Health program this year, and we are the call is closed already, and we are assessing the projects which we received. This project is targeting clinical and non-clinical staff of health systems, and will provide opportunities for continuous professional training with the focus on digital skills. So we are a bit experimenting because there has never been such an initiative at EU level. This is for the very first time that we implemented, but yeah, we believe that we heard from many member states that public funding for continuous professional training initiatives is quite limited. That's why we wanted to provide with something really which adds value and experiment a little bit with the topics related to digital skills. We also use the macroeconomic policy governance processes to encourage the efforts of member states to improve policies related to health workforce. And so we use the so-called European semester process. And you can see that in 2020 and 22, a combined total of 18 member states received country-specific recommendations related to health workforce challenges. So it's quite a lot, quite a prominent topic in this process. And what is important to stress that our guidance in the European semester affects very much how the European funds are spent. So we have a new financial instrument, which is the recovery and resilience instruments. And as you see, and some member states decided to use it as a framework to propose reforms related to workforce, or to use the fund to implement specific changes. So there is a broad spectrum of ideas presented in the national plans drawn by member states. They are already adopted by the Commission. So what you see on the screen represents the proposals which were negotiated and adopted by us. And in terms of reforms and investments in workforce, you can see that 3 member states proposed reforms which look at working conditions. It's not a lot, I know. But as the Resilience and Recovery Fund is a funding instrument, member states were, I think member states were more interested in more tangible projects, so infrastructure projects, for example. So there were much less, unfortunately, investments in the human capital, but yes, we have to see how we can catch up with it. So we have 3 examples of countries, Austria, Latvia, and Spain, who proposed to reform, who went for a more global rethinking of workforce policies, including working conditions. Bulgaria proposed some measures to improve attractiveness of health professions. There were quite some examples of countries who would like to reform their education systems, like the Czechia, Luxembourg, and Latvia. Some member states looked more about the role of nurses, regulating nursing professions. Some proposed various training measures, like Croatia for emergency specialists. Italy values broad scope of training measures, also Spain. Slovenia focused on palliative care. There were 2 member states who proposed to do something on workforce planning. there was one member state which decided to use this framework for improving well-being and integration of foreign health workers. It is Malta. Two member states proposed to increase the students' quotas, and one proposed to look more on the recognition of qualifications. There are also, of course, other financial instruments like the European Social Fund, which is the principal training instrument in the EU. So it can very well be used by member states to invest in staff of health systems, and the negotiations of the programs are quite advanced and ongoing. We have seen in some of the proposals the interest of member states to use it in the healthcare sector. There is also a technical support instrument with the flagship project on digital skills for digital transformation of health system, which is ongoing. So this is also an interesting initiative on our side. Finally, we also published last year an expert panel opinion on supporting mental health of health workforce and other essential workers. This is, of course, due to the severe effect of the COVID pandemic on the mental well-being of health professionals. And this opinion is the open source for inspiration on how to integrate the concept of well-being into the workplace in an inherent way, because very often thinking of mental well-being, we tend to think of mental illnesses, but this is a very restrictive way of understanding the issue. That's why the panel expert explains how the broader concept of well-being could be integrated in the workplace. The opinion is interesting. It addresses some policy recommendations to various levels. So yeah, in case of interest, you can find it on our website. I would like to thank you for your attention, and we'll be very happy to address any questions. Thank you.
Vielen Dank, Frau Ptak-Bufkens, für diesen sehr, sehr informativen Vortrag. Ich glaube, ganz besonders, was die EU jetzt macht, war von großem Interesse.
I think we're particularly interested in what the EU is doing here. I have a question. What I would like to know is whether COVID-19 has changed the cooperation between the European Union and member states. Usually it was up to the European Union to deal with credentials, monitoring and research, but you've just said that EU for Health is a big program, 10 times as big as the previous budget. And you were talking about the recovery facility, even though there are only 3 countries that use this problem for healthcare professions. And then there is the skills idea dealing with a European curriculum. And we heard about the European semester and healthcare professions. This is actually the budget planning of member states. So what about the member states? Are they really happy with it? Maybe COVID-19 led to a change of perspectives here, because usually it was really something up to the member states.
Thank you very much for this question. In terms, can you hear me? Yeah. In terms of responsibilities, nothing has changed, of course. So our member states' competences are defined clearly in the treaty. So according to Article 168, this is the member states' responsibility to allocate resources to health systems. So they, of course, remain competent in this area. On our side, we just propose some actions to help member states. And of course, I think the pandemic was unfortunately a good opportunity to push for certain ideas to materialize at our level. And it's difficult to say whether member states are happy or not, but I think that the best indication is their participation in these projects. So we have quite a huge interest in the joint action on workforce planning. We have 18 participating member states, and we may have one which would participate as the observer. This is something which I cannot confirm now because, yes, we will kick it off officially in 1 month. In terms of the cluster of projects, we also have quite a good representation of member states. So I think that, yes, there is an interest in what we do. The same for the call for training proposals. I think that it was the most popular call under the EU for Health program calls launched this year. We received the most of the proposals were actually submitted for the training initiative. So I think the interest is there. The portfolio is quite clear. We cannot really step into the competences of member states, but we try to focus on issues which are important. I didn't mention it, but you probably know our president announced in her State of the EU speech that next year will be the European skills year. So I think that what we do in terms of skills, that fits very well into this context. And I think, yes, that there are also other ideas to explore. Let's be clear. Of course, it helps if we are supported by member states, but yes, we also try to be very prudent about the competences, yes, not to step into the competences of member states. So yes, we hope that these projects are welcome, but yeah, we will certainly hear during the implementation from member states. And it will be also interesting to draw lessons for the future and to see where we can produce the biggest added value. Because, of course, we cannot replace member states in adjusting, for example, their education models, yes, to the needs of the future models of healthcare. This is impossible at our level. But yeah, we will be happy to draw lessons from it. And also this seminar where such an interesting survey is presented is also very interesting for our reflections on what we need to maybe learn more, what we need to do more, because attractiveness of healthcare professionals is something out of the scope of what we can do. But it doesn't prevent us from improving the knowledge about it. Yeah.
Wir hatten hier ein kleines Problem mit der Übersetzung. Beim ersten Teil Ihrer Antwort oder zweite Teil war
Unfortunately, we had a small technical glitch. That's why we couldn't hear the first part of your answer. But you said that there's a lot of interest from the member states. And you also said that this can be considered as a change of perspective. Mr. Benecke, you have a close look at our chat and the emails. Maybe you can give us a brief summary of what has been discussed so far. Well, I'm happy to do this. There is another question that was also mentioned by Mrs. Tuck, and this was about rural doctors in rural areas and how to attract young talents. The question is, what are the measures that need to be taken here, especially in medical deserts? Mrs. Tuck-Bufkens, you said that there are a number of projects dealing with medical deserts. You said these measures were taken 1 or 1.5.
Yes, thank you for this question. Yes, one of our projects presented a tool, a concept of the tool which can be used to actually determine the medical desert, because there is a lot of thinking about the methodology to actually agree what the medical desert is and what should be the policy solutions. And I think there is no one solution. The solutions need to be context specific, and what our work within the projects show, what is important is to involve actually healthcare professionals, because I think that understanding of policy incentives at the policymaker level and the healthcare professional level can be very different. That's why this project is really showing that the involvement of healthcare professionals is actually crucial. So there is no one solution. I think that attractiveness of working in such areas can be improved through better education adapted to the needs of such areas. So, for example, more practices for students in these areas that can certainly inspire some interest of healthcare professionals to stay in, because I think that medical students, they are not given enough chance to understand how satisfying the experience of working in rural areas can be. So this is a very soft factor, but I think this is a very important factor. We cannot only think of the figures and highlight only shortages. We have to think of how to arrive at certain objectives. This is more important than the journey is more important than the objective in that case, I think. So yes, these projects provide an opportunity to discuss all these soft factors which matter.
Vielen Dank für diese Antwort. Ich glaube, das Besondere an den Projekten ist, dass sie zwar wissenschaftlich fundiert sind,
Thank
aber
you very much.
und auch vor allem in den Mitgliedsländern.
I mean, the project are both scientific and very practical. And of course, you also want to see very tangible results in the member states. I don't think we have any other questions on the chat right now, which means we can move on to our little panel discussion. Now, let me introduce our guest, Mr. Hofmeister from the KBB. And I would have thought that this is really a topic that concerns the future. And now I think we've realized that it's very much about the presence. And now, after everything we've heard, let me ask you, did COVID-19 change your perspective on the training, on the profession, on the future? And I mean that in two respects. COVID-19 has exacerbated many of these structural problems we had anyway. But we've also seen that we have a very agile healthcare system, and people working in that sector have also responded very flexibly. Have we also become more innovative and flexible in the process? First of all, thank you for the invitation. You know, I'm really here to listen because I want to know what up-and-coming doctors are saying. I think what we need is not difficult to describe. And whether COVID has changed that, you know, I don't want to portray COVID as the big game changer. When we've had pandemics in the past, the Spanish flu, and I think we've always learned our lessons, and that's how we've also learned lessons from COVID. It's been perhaps a magnifying glass looking at the problems we have in Europe. For Germany, I think the diversity and the flexibility of our healthcare system have really been shown. We are a bit like a beehive. We have a lot of very small cells working independently and very resiliently within our system. And that has been very successful in Germany because they've remained strong. They haven't always been treated well by the public and the politicians. But I hope that in terms of organization, the language we use, we have really improved. But if I look at what the doctors, nurses, people working in hospitals have done, that has been really impressive. So it was possible to deal with the situation, but we can't continue like this forever. In Germany, we have an aging population. I'm part of that myself. And even if I might still feel healthy right now, you start wondering who's going to take care of all the elderly people in the future. I think what we need to do, and we've seen that also for the EU, we need to retain people working in the area, and we need to motivate people to join the workforce. We will need more people because there's more work, and we'll need all the support that there is, like, for example, digitalization, cross-sectoral collaboration. We need to find out where we can shift tasks to others. I think that there is a lot of potential. It's an opportunity. And COVID has perhaps just highlighted some of these issues. Thank you. You said it's about task sharing, labor sharing, digitalization, collaborating, making the profession more attractive. That's a very good segue to Ms. Freitag. We've heard in the presentation by Professor Jacob how students perceived studying during COVID-19. Now, what are these solutions that students have in mind? Also looking at the shortage of people who want to work in surgery or in general medicine. You know, there's one thing that we as students keep repeating, and that is the visibility of outpatient care. It's not very visible when you study. While I was studying, I only had practical training in an outpatient setting for 6 weeks, and that's not very much. It doesn't give me the whole picture of outpatient care. I spent much more time in hospital, and I think it would be really important to change that. Outpatient care, general medicine in rural areas need to become more visible, and the students need to have more experiences of that kind. Thank you. And this is actually also my question to Mr. Rothoff from Augsburg University. Because you're doing research into teaching and training, does all this mean that the training has to focus more on outpatient care? Do we need to focus more on the work of general practitioners in rural areas? Is that the way we need to change our medical training? Now, good morning, first of all, and coming back to what Ms. Freitag said, I can only agree that this is something that the students need to learn about and need to experience. As you said, we're all waiting for the amendment to the regulation for licensing doctors. And the new regulation explicitly talks about outpatient care, be it for acute treatment or chronic treatment. And hopefully, once we have that regulation, we will necessarily have to adapt our curricula. And the focus on outpatient care has really been strengthened with that new regulation. That's the general orientation that we are pursuing. But at the same time, if we do that, we also need to make sure that the quality is assured. If I think about the university and the teaching of teachers, if I start hiring new teachers that can talk about these things, then we need to make sure that the quality of their teaching is also assured. At the moment, we focus on scientific training most of all, but the teaching quality needs to be maintained even if we change the direction of the training somewhat. Thank you. And then I would like to welcome Dr. Streitlein-Böhme from the Society of University Teaching Staff in General Medicine. And we don't want to talk about teachers or about students, but we want to talk with them. And we wanted this to be more inclusive. So what do you say, listening to the discussion? Do you think that there is progress? Is this something that you would agree with in terms of the development we want? Good morning. Thank you for the invitation. You asked me whether I think this is not happening fast enough. No, definitely. We should have started this 15 years ago. I myself worked in healthcare, and I then decided I wanted to work at the university and teach doctors. And I do see that there is a lot of pressure. We need more outpatient care, more GPs, and we need more doctors who are willing to do this. And I think we've improved a great deal. And that's thanks to medical schools who've not only taught the students, but also taught the teachers. They train their staff to be able to provide this training. And by doing that, I hope our society has also made an important contribution. And now the new licensing for doctors regulation needs to come into force. And then in any case, it will take 10 years for the impact to be seen. But yes, there has to be more focus on outpatient care during training. And then we must not only focus on primary education, but also ongoing training. Okay, so you're saying once the new regulation is in place, it will still take 10 years for the impact to be seen. Now, what about lifelong learning and further training? Isn't that something we could use to speed this up, so that we can train people faster? I think what's important, and that's why the regulation needs to change, we need to make sure that these students have the right skills when they finish their second phase of practical training. They must be able to face the practical reality of working as a doctor, be it in a hospital or in free practice. And this is something that needs to become an integral part of our training. Of course, they need the knowledge, but they also need the action skills to put everything that they've learned into practice. We need good communication skills. The patient-doctor communication is something that has been neglected quite a lot, because many doctors don't really have any time anymore to speak to the patients. There is growing economic pressure on doctors not to spend too much time with one single patient. And the students, when they start studying, they want to help people, treat people, and they want to be with the patients. They don't think about the return on investment. And that's not what they have in mind when they start. And that's a problem in Germany. Thank you. I have a follow-up question here. We've heard from Ms. Ptak-Bufgens that the figures alone might actually not tell the whole truth, but that it's also about how we collaborate. I saw in Professor Jacobs' figures that many students are interested in working in a team. I think the figure was very high in France, mainly because I think they don't have a lot of teams. But teamwork is very important also for German students. What is your point of view on this? What should be the team of the future? What will be the network of professions surrounding a doctor? Could it even be cross-sectoral collaboration? Now, myself worked as a GP for a long time, and you can't do that without a team. It starts with the nurses. I also worked in palliative care. And then necessarily you have to have a good team. And they might be third partners also working with you, or a pharmacy, or specialist doctors. And I think it would be fantastic if we also had an intuitive, smoothly working digital system that enables smooth communication. At the moment, people are still sending faxes. What we need here, and I think specialist doctors would agree, is to have that network. I talked about a beehive model before, but even in a beehive, there has to be some center, which means we shouldn't be competing networks. The question is always, who is the owner of that process? And I think this will mainly be the doctor, because doctors generally have the broadest training. I'm not saying it's the best profession, but the doctor is, so to speak, the super specialist and has to be the node of that network. We've seen the European slides, and we've seen that Germany is in the upper right square, and we actually have a lot of nurses and a lot of doctors compared to others. But still, we're complaining in Germany that there is a lack of nurses and doctors. And that again tells us that it's not just about figures. It also depends on the perceived demand and need and where people work. So it's not just about figures.
Thank you, Mr. Hofmeister. And Mrs. Freitag, I have a question to you. Are you under the impression that your fellow students are really prepared for heading a team and for task shifting, for example? Because in other European countries, sometimes tasks are shifted to nurses or assistant doctors. Do you really feel prepared? Well, very well knowing that actually you would need digital tools to support this teamwork. Well, thank you very much for this question. This is actually what I had in mind when listening to you. There is a lot of potential to tap on when it comes to teamwork and focusing on doctors at the center. But I don't really feel prepared for this. This is not what happens during our studies. We need to learn more on how to be the leader in this case. There are more and more projects. There are interprofessional training stages, but we need to learn more about it, and we need more skills, and these skills need to be defined. Who has what skills? And when graduating, we're not quite sure who we can address and who has the expertise. And when it comes to digitization, the monitoring has illustrated that there haven't been any changes in the past 4 years when it comes to digitization, because we don't really have nationwide education. Then there is this new learning objective catalog, and we hope that we will see some improvement there, but I think there's still room for improvement. Mr. Rothoff, from the scientific point of view and training point of view, teams, task distribution, what do we need to do? I think we've made a lot of headway, but there's still some, remaining potential. But we have seen a number of initiatives taken in the past 5 and 10 years, for example, by the Robert Bosch Foundation. So there are a lot of incentives and ideas on how to improve professional cooperation and how to integrate this in the curricula, but we shouldn't underestimate the fact how trainers are actually dealing with it, because we also need to help medical schools to make progress, because they need to put a focus on interprofessionality as well. That is why we need to train the trainers and help them to change their mindset to find out what teamwork actually means. This is not only about training students, but also training the trainers. When it comes to digitization, there's a national catalogue of learning objectives that covers the majority of these items. I'm talking about systems to support decision-making and telemedicine. But we should also focus on the different specialities using these tools. I think it's not the right thing to have additional courses on digitization or interprofessionality, because this would be too much. We need to focus on medical content. That's why I believe that on a national and international level, we should try to integrate these aspects into the specialities and disciplines. We're talking about medical students, but when talking about teamwork, we need to cover other healthcare professionals as well. And do you think that medical schools are really able to reach out to other professions? Well, I think we're trying to, find out and identify what to do, because Germany is a bit lagging behind here. We're talking about academization of midwives and physiotherapists and long-term carers, but there are interfaces where we can cooperate. Mrs. Freitag has already mentioned it is important to find out what is your expertise and what is the expertise of other professions. This is something that we need to explore, because many things are working smoothly today, but other things are not really clear. And this is where we need to identify different tasks and expertise. I think I'm quite optimistic. Here, we will make more progress in the future, because it's very similar at an international level. And although we are lagging behind, the Netherlands have made more headway here, but I think, we've come a long way. Mr. Rothoff, I have also a question to Dr. Streitlein-Böhme and your perspective of university teaching staff. Do you think there are possibilities to promote team building, but within the curriculum, but also with practical experience? If we look at general medicine, for example, we, worked together with nurses and their doctors in free practice and have some practical courses together. This is what we did in Baden-Württemberg. Here in North Rhine-Westphalia, we do so at the medical school level, because medical professionals and nurses, they can also be integrated in these teams, and they consider this to be an opportunity. So there are a lot of approaches, but there are also different medical schools where we have interprofessional teams that work together during the practical education. So it is a good thing to have interprofessional teams during the practical training phase. Well, when it comes to medical professionals, I think this is a good resource because many people try to follow the German example and to introduce something that is well, similar. Have we really used this or seized this opportunity? We tried, for example, to qualify physician assistants, also for student training, and they are really very happy to do this and to do more, for example, geriatric assessment. This can be done by physician assistants because this is what they do every day. And talking about, dealing with digitization, because this is what they have been doing all day. And these are resources that we need to use, and this will improve interprofessional cooperation. Well, physician assistants are really important, and this is also important for the students doing their practical training after the first state examination. But for them, it is really important because they have to deal with patients, they had to deal with COVID-19. So this is really a stretch for them. And then these physician assistants have to deal with students in addition to their everyday work. And if we want to take this very important step, then we need to, include this in the remuneration, but we may also need additional staff to deal with these challenges. But political decision makers do not really seem to prepare to do this. This is really necessary, and this is something that we need to do because there's so much potential. Well, it's a good thing to promote these things because you are also, fighting for other healthcare professions as well. Mr. Benninger, maybe we have some more questions, but I'm sure that everyone is really following our discussion. So there are no more questions. Mrs. Freitag, talking about physician assistants, and you said that you would like to closer cooperate with them. What about the experience of your fellow students about reaching out? We have been talking about physician assistants, but what about physiotherapists? And then there are a lot of primary health care centers. They also try to get social workers on board in order to take a holistic approach to patient care. What about the current situation and your ideas? I was actually quite surprised to hear about these numbers, that there are fewer and fewer students interested in the living conditions and the patient situation as a whole, because my fellow students are very much interested in the social environment of patients, and they're also interested in cooperating with other healthcare professionals and learning from them. So at my medical school, the idea is to adjust and adapt curricula. This is a big challenge because some healthcare professionals, well, they don't study, but they do vocational training, so it's very difficult to combine these two. But I think students are definitely keen on doing this. Mr. Rotter, from an academic perspective, well, matching the curricula of different healthcare professionals is a challenge, isn't it? Maybe we have some issues with political decision-making and governance. What do you think from an academic point of view? Well, I think everyone is prepared to do this, investing in interprofessional cooperation, but it is a challenge. Looking into figures, for example, I can tell you, if I have a huge number of medical students and there are, well, let's say 30 physiotherapists, well, this is also a problem capacity-wise, and it's hard to develop a fitting concept here. That's why co-education doesn't really make sense here, but it is important to help students and trainees to understand what the expertise of other healthcare professionals are and when tasks can be shifted or not. We can do this by individual projects or individual modules that can be integrated into the curriculum, because we shouldn't, well, overburden medical studies, because students are not specialists yet. Well, we cannot overburden the medical course as such, and I think this would ask too much from medical students, because they also complain about the content of their studies. Thank you, Mr. Rotthoff. Dr. Streitlein-Böhme, what I would like to know is, sometimes at some universities have made more progress than others. So they have identified certain issues and they have already found an answer or a solution, and there's some model courses. So maybe there are examples that we can use as a best practice example. Yes, for example, during the practical training stage, but there are also universities like Witten-Herdecke with model courses. They have an additional number of students, and they have tandems, and they cooperate with other healthcare professionals. So they are part of a team from the very start. So there are some new approaches in Freiburg, for example. There are, we cooperate with the care scientists, and they cooperate with, let's say, 5 medical students when it comes to care homes or, trying to provide medical care to refugees. So there are a lot of good ideas, and we need to find out whether we can transfer these ideas to other universities and medical schools. But we should speed things up, and innovations usually take their time. Usually take some years in order to implement these ideas, and sometimes those who created these ideas, they might leave, and then we're not really following up. So what we should do is to promote innovations and try things and have an exchange about it and try and find out what we can do with our medical schools.
I think Mr. Bennecke wants to say something. Yes, that's right. There is a message on the chat, and somebody talks about the European level and says there is such a lot of mobility across national borders, looking at doctors, and then it may happen that they're all trained in one country, but then all work in a different country. The question was whether that could somehow be considered during the training. Mr. Hochmeister, I don't know. Mr. Hochmeister, did you want to answer that? Well, I'm not really the one to talk about academic issues. But, you know, I'm a big fan of free movement, and I think people should be able to work wherever they want. But if you end up in a situation where those who have more money just lure away people to their own country because they can pay more, then that's not a good solution. We need to be able to create a structure and a workforce that works well here. And if then people from other countries also want to work here, that's fine. But once it becomes a drainage or a brain drain, that is not a good solution. And I think it would even go too far to integrate this in your studies. You can already decide to go on an Erasmus program and study abroad, but basically teaching people that they then continue, that they are able to continue working in Norway, I don't think that would be really helpful. So that means the more prosperous countries need to be self-sufficient, so they don't need to take away specialists from other countries. Yes, that's right. And I think it's every single country's job to train the people that it needs. But that means we should monitor better where people move, where they go to work, whether they remain in the profession or whether they drop out entirely. Before we talk about financing the system, I would like to think what you think about people being lured away to work in other countries. I mean, many students are motivated to travel to different countries and work there for a while. But there are also countries where there are problems with specialist training, and that's why students move away. Yes, that's absolutely right. A lot of students want to move somewhere else, learn about other healthcare systems. And as you said, everybody should have the possibility to live and work where they want. Because, of course, in the end, there shouldn't be a brain drain or a country losing out because everybody moves away. What was your second question again? You know, there is one topic I would like to come back to, and I think it's really important. That's about investment in training and in healthcare professions. And then we also need to talk about people's salaries. I think there is a general consensus on this, which is that everybody should be paid well. But then the question remains, how can we fund all of this? We spent a lot of money on COVID-19. We took on debt to finance these measures, and they will have to be repaid at some point. So what is our plan? What are we going to do in a situation where there will actually be less financial wiggle room? Mr. Hofmeister, would you like to start? Yeah, well, the 18 billion we spent on COVID in the first 4 months of this year, that's very questionable anyway, also from an epidemiological point of view. I think if we can't afford to keep our healthcare system stable, the costs will eventually be much higher. And then secondly, I think citizens need to realize that they can't always have everything. I mean, look at the Swedish or the Norwegian system. They have a system very much based on nurses. You have to wait for a long time for your appointments. And, you know, here in Germany, if you want to see an orthopedic doctor, you don't have to wait for more than a week. And so basically, the German system suggests that everything is always available. But that's wrong. That's not the way it should be. I think we can definitely save money, also by collaborating. But I mentioned previously how certain services are financed. Some services are not part of the calculus here, like, for example, training in hospitals. When doctors are trained in hospitals, that's part of their budget. When doctors are trained in free practice, it's not part of the budget. But in principle, I think Germany can afford it and has to afford this. You said in the beginning that COVID-19 shouldn't be portrayed as the game changer, but hasn't it still changed our view on this situation? Because the question is, what about investments in bad times? Do we need to continue investing, or is that rather the time to save money? What is your take on this? After all, we're talking about the future, and investments that take place today should pay off for your generation, basically. I mean, we also have this discussion when it comes to teaching. People say that studying medicine will become more expensive. Then people try to come up with estimations with how much that will be. And people want to find out whether we can afford it. But the fact is, we need that amended regulation. We need a type of training that is up to date. We can't work with a curriculum and a system that's been established 60 years ago. That means, from a teaching perspective, it is extremely important that we continue to invest. Of course, we need to analyze what exactly it is that we need and invest in the right place. But I don't think saving our way out of this is going to work. Professor Rotov, you also talked about the boundaries of the university system and that there are a lot of tasks that should have been taken many years ago. And what is your view here? What would be the most urgent thing to do? Where should the investment go, and where would it be most effective?
Ich glaube, ein wichtiger Punkt ist, dass wir immer noch sehr inhaltsorientiert sind. Das ist natürlich eine Basis.
I think what's important is that we focus very much on the substance and the knowledge, and this, I think, is one of the fundamentals. But I think we should shift our focus to more practical skills. Students have to be able to apply the skills that they've acquired, and they should also start taking on responsibility. And that would also help to also integrate them into the system while they are studying. I mean, the students are a resource, and we only consider them somebody who needs to be taught instead of using them as a resource. And during COVID, a lot of students participated very much in the practical work. And perhaps that is something we need to do, make them aware that they are an active part of a team, even if they're still students or still in training. Thank you, Ms. Streitlein-Böhme. From your point of view, when it comes to the university teachers, if there was only limited investment possible, where would you focus this? I think I would focus on amending the regulation. And there needs to be a focus on the outpatient sector. It doesn't have to be a huge investment, but there should be adequate financing. And students should at least have 6 weeks of practical training in free practice. And then at the end, there should be an exam in a GP setting. I think that's really important for the students. If there is an exam, you can be sure that they are more committed and more willing to learn. I think that's what we need. That's what I would like to see. And we need it soon. Let me look at my colleague whether there are more questions on the chat. Apparently not. And we have another 5 minutes. Perhaps we have a concluding round, but we start the other way around this time. Now, thinking about the discussion we've had, the impact of COVID, how we need to change our learning patterns in the future, what investments do we need, what would be your hope for the future? Ms. Freitag. Now, we talked a lot about how the teaching can help to shape our healthcare sector. That's, of course, very important. And something that I must say shocked me looking at the survey was that there is a growing interest in outpatient care settings. But to me, the question is, at what cost? I looked at the results of previous waves and the reasons why people want to work in outpatient care and not in a hospital. And then mainly their reason was that they simply don't want to work in a hospital. And that shouldn't be the entire motivation. Outpatient care should be made more attractive. But I don't think it's a good motivation to work in outpatient care just because you absolutely do not want to be in a hospital. Many students think that the workload is way too high in a hospital, and that's why they don't want to work there. And here the figures are shocking, which is why we need to come up with an overall solution for our healthcare system. Thank you. I think that's a very important comment. It is true, if one part of the system is not attractive, the other part can't become attractive because it's overburdened. And then perhaps it would be better to shift tasks to solve that problem. Now let me jump to Mr. Rothoff. Having listened to our conversation, what is it that you would like to see in the future? And you, as a professor working at a university, I'm sure you have a lot of ideas. Now, education is not for free, no matter where you end up working. So one question is funding, and the other question is time. If I have enough time for training, I think this can succeed. And in many areas, I believe we are not effective enough. And you just said we need to have a more systemic approach, which is absolutely true. If I send students to a hospital or to an outpatient care setting, they are confronted with role models. And we know that role models are an important inspiration for your later profession. Let's say you find a good role model, be it in free practice or in a hospital, that will always have an impact. That means it's not enough to consider optimizing the training of doctors, but we also need to make sure that their practical training settings are inspiring. And then I think that will have a very important impact on the students. Thank you. Yeah, I mean, it's something that we've all been knowing for a long time. It's just something we need to get done.
So maybe you can tell us more about your practical experience. Well, from my perspective, I think it is really important to deal with the economic pressure. This is really an obstacle for many doctors, also when it comes to communication at hospitals and free practices. This is a big issue because we need to retain medical students. They need good working conditions with eye-level communication, doing away with traditional hierarchies. This is an important factor. We need to take medical students on board, so less economic pressure and better communication. And of course, we need to train the trainers because we shouldn't take this for granted. Well, being a professor doesn't really make you a good teacher. So it is really important that we need a good qualification of teachers, and this will help to improve our medical courses and programs. So I would like to thank the KBV and your colleagues, and so I would like to give the floor to Mr. Hofmeister. So for us, it is really important to help medical students and improve their working conditions and good teachers in order to make sure that we can provide good health care. So there's one takeaway. Well, medical studies are medical studies. There are a lot of things that you learn and that you will definitely need later on. And well, but we have to avoid overload. My son has been a medical student for a few weeks, and I hope that there will be a good, that the curriculum will be a good one. But in Heidelberg, actually, I was quite lucky to find good teachers with a lot of great skills, good communication skills, networking skills, finding out about the expertise of others. And this should not happen by accident. This should be really part of the curriculum. I was happy to work on a ship. There is one captain, and there can only be one captain. But well, everyone on board is equally important because you know about the skills and the expertise of others. And this is very similar to healthcare services. Well, we are all in one boat. We are all one team, and this is what medical students would like to see in the future. So if medical students graduate and this is what they have learned, then they, of course, are best suited. We need doctors for outpatient care settings. I'm not talking about heart surgery, but dermatology, for example, is something that should take place in an outpatient facility. So we need more investments here. There's one thing that I would like to tell you in the end. When Austria presented their outpatient care concept, focusing on the patient, this idea shifted to focusing on GPs and the team of GPs. And I was under the impression today when talking about doctors, students, and trainers that they have a lot in common, that they have a similar take on issues and how to deal with them. And the discussion about investment, well, this was not an investment and a discussion about remuneration, but how to improve the system as such. And that's why I'm very confident. And on this positive note, I would like to thank the panelists. I would like to thank Mr. Jakob for this great presentation, and I would also like to thank Mrs. Ptak-Bufkins. Mr. Hofmeister, thank you very much for joining us online. It would have been even better if you could have joined us here. Thank you very much for all those who joined us online and their chat contributions. So thank you and goodbye.